you, Dr. Monica. I always appreciate the introduction. Hello. Okay, everyone, good morning. Today we will be figuring out how to measure each other. Actually, we will be figuring out ways to figure out our frame size. I have these instruments that we will be using today because every time you see a patient or a client, you always have to complete a nutritional assessment on your patient or client. And what's important to do is to be able to figure out their caloric needs and their protein needs. And you need that information for every single person that you see. And it's also important to know what frame size they are. There are some people, though, who don't know how tall they are. Sometimes patients will tell you, oh, I used to be 5'7", but now I don't know how tall I am. And you might be surprised and say, well, wow, how could that be? Is it possible to change heights? Could you get taller? Could you get shorter? And it is true, though, for older folks, that some people actually might lose an inch, depending on their status of their bones. If they have lost bones, if they have lost any bone structure, they might have lost an inch. It might be possible. And then there are some patients and clients who just don't know how tall they are. So a good dietitian, whether you be working in the hospital or whether you be working in a clinic, in an outpatient setting, always have a measuring tape with you. It does not have to be fancy. It doesn't have to be expensive. It can be as inexpensive as this one that I have wadded up in my hand. Okay, so today we are going to figure out somebody's frame size. And when I say somebody, because I want you to work in partners, in pairs today. I have 3 measuring tapes, so I'll be passing these around. So here's one section here to my left, the middle section, and you to my right. Okay, so we're going to pass this around. And so in order to figure out some people's height, if a patient is in their bed and they can't stand up for you, what you can do to figure out their height is to ask them to spread out their arms as wide as they can. And take your measuring tape, and you might need the nurse that's working there to hold one end at the tip, at the very tip of their finger, okay? And then have either you or the nurse will hold that measuring tape to the other end of their fingers. So it would be tip, this middle finger, and all the way down to the middle finger. And they say that your arm span should be somewhat equivalent to your height. Okay, so if a patient says, I don't know how tall I am, and they're in bed, they can't stand up, then you can at least measure them tip to tip. It may not absolutely be right on, but it's a ballpark figure that's somewhat close to their height. So you can try that today and see if it's close to what you think you are, how tall you are. All right. Now, I have this sheet up to also determine if your frame size, if your friend's frame size is small, medium, or large. And how you do that is that you take your weight in centimeters. You're amazing. Thank you so much. I appreciate your help. You're so fast. Okay, so you take your height in centimeters and then you divide it by the circumference of your wrist. And you know, I don't think we have to actually measure my wrist to figure out that I'm small frame, obviously. But some people, it's hard to tell just by looking at your patient. You know, some of them might look like they're medium size and some of them might be a large frame. And it's really good not to guess. It's good to get it right on. So when you figure out their ideal body weight, then you're very close to your, it gets you closer to your calculation. So what you're going to do is you're going to take this measuring tape and then take your partner's wrist and then measure it around. Okay, so here are the bones of the wrist. I know I have a very, very small wrist. And then you just measure it, put the measuring tape just right where it meets, and then look at the measurement in centimeters. And then I hope some of you have your phones with a calculator on it, hopefully. Okay, so take your height in centimeters and divide it by your wrist circumference in centimeters. Whoops. Thank you. Okay, so for females, here it's on the right side. For women, if the answer that you get is greater than 11, then you have a small frame. And mine, when I did mine last night, it was 11.5, so I'm definitely small frame. And if you're male, if it's what you get is greater than 10.4, then you're a small frame. Okay, and then for medium, it's 10.1 and 9.6 for male, and a large frame is less than 10.1 and less than 9.6, okay? So I want you to get a partner and to figure out each other's frame size, because the next step is that we will figure out what your ideal body weight should be using the Hamwe method, okay? So if you can please pass this on. Okay, so everyone find a partner and then measure, write down on your notebook or on a piece of paper what your circumference size is, and then divide your height by the circumference of your wrist. So we'll just keep passing these around. Okay, everybody's going to figure out their frame size. Okay. Yes, and also if you want to figure out your height by doing the tip to tip, spreading your arms out and measuring from the tip of your finger to the other tip, and just compare to see if that's really how tall you are. So we're finding out frame sizes today. So just keep passing them along. And sometimes too, if your patient does not want to put out both of their arms to figure out their height, then you can at least have them put out one arm, measure from the sternum to the end of their middle finger, and then just double that. And that should also be another way of figuring out their height. So it's just another option. Very good. Looks like you all are. And compare each other's frame size too. Try to guess your partner's frame size before you finish the calculation and see if you come close. Yes, so do both. Do your arm span and also do your wrist, the circumference of your wrist. So remember now, a good tool to have as a dietitian is to have a measuring tape with you at all times. Okay, we can keep on measuring everybody. And in the meantime, I'm going to have somebody volunteer and give me their height. But keep on measuring until everybody's measured. So who wants to offer their height to us in centimeters? Volunteers? Oh, okay. Yes. 168 centimeters. Okay, 168 centimeters. And we are going to, let's see, divide, symbol, where is the divide sign? Okay, so what was your wrist circumference? 14 by 14 centimeters. Okay, so does somebody have a calculator? 168 divided by 14? 12. Okay, so 12 was the number, and oh, I actually minimized that. Okay, so, all right, so greater than 11, small frame, just like me. You're a small frame. Okay, so keep measuring. Okay, so this is what we're going to do. We are actually going to find out what your ideal body weight is, okay? Okay, everyone, so what we're going to do here is keep measuring. I'm going to show you something else. Oh, I probably didn't do that one. How many of you are familiar with the Hamwe method? Hamwe method? Okay, no. Well. Let's see. Can I make it bigger? Control L. Oh, that's still small. Oh, let's see. Oh, there. Cool. Okay. Okay, ladies and gentlemen, you're going to have to bear with me, but we are going to work in pounds first, and then I will lead you and guide you in converting from pounds to kilograms. Us dietitians in the hospital, we actually do work with kilograms, but for this sake, for a Hamwe method, we have to use, let's see, we have to use pounds first. Okay, so are you used to working in, like, if I say 5'6", 5 feet, 5 inches? Okay. So how tall are you? Okay. Oh, 5'5". Oh, okay, perfect. Okay, so to figure out the ideal body weight of someone who is 5'5", who's female, this is the rule for the Hamwe method. It's up here. For the first 5 feet, that person, well, for anybody, the first 5 feet will always have 100 pounds for female. We're talking about female right now. And then for every inch above the 5 feet, so if our student here is 5'5", 5 inches, so then you take 5 pounds for every inch after the first 5 feet, okay? So the first 5 feet is 100 pounds, and then you add 5 pounds for every inch after that. So 5 pounds, we're going to put 100 pounds, and we will take 5 pounds times 5 inches. That's 25 pounds. So we're going to add 25 to 100. So that's 125. Is that clear, or is that a little confusing? Okay, so for the first 5 feet, it's 100 pounds. And then, because, okay, so I'm going to work on this third line. I'm just showing you that since she's 5'5", 5 inches, we're taking 5 inches times, where is my multiple sign? I'll just use an X, times 5 pounds. So that gives us 25 pounds extra. So if we take that 100 plus 25, then her ideal body weight is actually 125 for someone who is 5 feet and 5 inches. 5 feet and 5 inches. This rule is for someone who's medium framed. But if your person is small framed, then you have to subtract 10% from 125. If your person is large framed, then you have to add 10% to the ideal body weight that you calculated. So in her case, she's small framed. So if you take 125 times 0.1, okay, so what, 12.5. So what's 125 minus 12.5? Can somebody calculate that for me really quick? I'm sorry? 125 minus 12.5. 112.5. Okay. So this is her ideal body weight. For someone who's 5'5", who's small framed, this is the ideal body weight. Okay? And it doesn't mean that the person has to be right at 112.5 pounds. But you can, you know, give a little leeway. But in kilograms, you would take 112.5 and you would divide that. Okay, where are my symbols? You would divide that by 2.2 to convert to kilograms. And so what's 112.5 divided by 2.2? 51.13. Okay, so let's just say 1. So this is your ideal body weight for someone who's small frame, 51.1. Okay, for males, it's slightly different. For the first 5 feet, it's 106 pounds. And then for every inch after that, it's 6 pounds per inch after that. Okay, so it's slightly different for men. Okay, is it clear the difference? But you do the same thing for men. If they're small framed, then you subtract 10%, and if they're large framed, then you add 10% of the ideal body weight. What we always figure out initially is the medium frame. Okay, any questions about that? It's really simple. Yes. Good question. Doesn't match to the body mass index. Actually, there will be times that you'll look at it and you'll say, wow, that doesn't match at all. Actually, the body mass index equation is best to use. But when you're actually, you know, but with the body mass index, it doesn't give you ideal body weight. So, but body mass index is good to determine risk for diseases and things like that, obesity. So always figure out the BMI too, the body mass index, in addition to also figuring out the ideal body weight. When I do my nutrition assessments, I do both. And then once I have my ideal body weight, see, this is where we compare, actually. Is it okay if I go back to you and ask you what your actual weight is? 58. 58. Okay, 58 kilograms. Thank you so much. Okay, so the next thing to do when you're doing an assessment is to take her current weight. We are going to figure out the percent ideal body weight she actually is. She is currently 58 kilograms, and then we are going to divide, insert my symbol. We're going to divide by 51 kilograms. And can somebody please divide for me 58 divided by 51? I wish I was that brilliant in math, but I'm not. 58 divided by 51. 113. Okay. And then when you times that times 100, then that gives us 113%. Okay. So she's good. Now, just because it's over 100% doesn't mean that she's obese or overweight at all. What's ideal is if a person is anywhere between 90 to 119% of their ideal body weight, then they're fine. When you figure out their calories and protein, that means you can go ahead and use that weight. Okay? If they were less than 90%, then that means they're underweight. If they're 120% or more of their ideal body weight, then we actually have to do an adjusted body weight. And that's another calculation, and we'll see later if we have time to go into that. But back to your question. Sometimes we might have a patient in which they're at 118% of their body weight, and that's still good. Well, and then it doesn't match to the BMI. Sometimes it could be making it look like they're not within normal range. So none of these calculations, I will say, are perfect, but it's a guide. But it's what we have to use. Okay. All right. So for the times that you might be working in a place where they don't have guidelines as far as, okay, we use this table here at this hospital for ideal body weight, and they have a chart to give to you. If you work at a place like that, you can say, oh, you don't have a chart to figure out ideal body weight? No problem. I'll go ahead and figure it out by using the Hamwe method. So that's what this is called. Let me write it out for you. It's called the Hamwe method. Yes? Right. We primarily use this for adults, and because with children, they're still growing and things like that. Adolescents, yeah, older adolescents. Yeah, so yeah, this really wouldn't be ideal for younger kids, though. Now, once in a while, you might get a patient or a client who is under 5 feet. Okay, they might be 4'9", 4'10", and instead of subtracting 5 pounds for every inch that they're under 5 feet, you actually just subtract 2.5 pounds per inch below 5 feet. So if they are 4'10", so that's 2 inches below 5 feet. So you will take 2.5 times 2. So then you would subtract 5 pounds from 100. Okay. I used to think it's, well, you subtract 5 pounds below 5 feet from 100, but it's not like that. It would give them a very, very low ideal body weight. So you just subtract 2.5%, but you still use the concept of, well, if they're small framed, then you subtract the 10%. If they're large framed, then you add 10% to that. Okay, all right. So does everybody have their circumference of their wrist measured? Everybody knows what circumference, what body weight frame they are? Here, let me bring up that chart one more time so that you can see where you are at. Okay. So view. Okay, so there's that chart one more time. So now you know where you all are at this point. Okay, so the next thing that we are going to do, that you'll have to do with each other, is to figure out your waist to hip ratio. This is another thing, another tool that you can use to figure out for your patient if they are at risk for cardiovascular disease. If their waist to hip ratio, you take their waist in centimeters and you divide it by their hip measurement in centimeters. If the ratio for men is greater than 1, then they are at risk for cardiovascular disease and all those other diseases. For women, if the ratio is greater than 0.8, then you're at risk for, your patient will be at risk for cardiovascular disease. So why don't we do that right now? Okay, so when you're measuring the waist, it's supposed to be above the umbilical cord. Okay, so it's this section right here. And then for the hip, it's supposed to be at the part where your rear end is the biggest. Okay? Where your seat is the biggest. So if you're comfortable doing that, then with your partner, with your friend, if you could do that waist to hip ratio right now, then please go ahead and do that. We have 3 measuring tapes, and we are going to pass those around. And the thing is, you know, it's important to be practicing this on a regular basis. You might think that just measuring is might be easy, and it should be, but the thing is, everybody measures differently, and make sure that the measuring tape is flat as much as possible, not too tight. Yeah, it's perfect what she's doing right there. Okay. Wow, there's a nice blue measuring tape. Good. Somebody is already a good dietitian already. Look at that. I didn't bring that blue one. So good. Okay, yes. Okay, now the thing is, too, if you just want to take the waist of your patient also. For men, you really should not be beyond 40 centimeters. And for women, you shouldn't be more than 35 centimeters, because if you're beyond that, then that means you're also at risk for cardiovascular issues as well, all these other issues. So we want to stay slim and trim as much as possible. And it's not a do-all, say-all, you know, oh, you're going to die if it's more than that. It's just a guide to encourage you to exercise more and to, you know, be a good example to your patients. But the reason why this is really important, you know, you will have time to do this in an outpatient setting. But to do this in a hospital, there's usually not enough time, because there are times you have to see 10 to 12 to 13 to 14 patients in a day. And it's really hard to take time and say, okay, I'm going to measure you all these different things. It's busy in the hospital. You just got to be able to go in there, educate them, and just use the height and the weight that's provided to you. But what I like about working in an outpatient setting is that you're able to see your client more than once. And especially if they want to see you for weight loss. This is very important. Keep track of this, their height, their weight, their frame. And then we are going to be figuring out skin fold thickness. And if you can keep a track of all these measurements every time they come see you, you'll be able to see either progress or no progress. And when your patients and clients will see numbers change, when they see that every time they visit you, the numbers are getting smaller, that's encouraging to them. Instead of just, well, yeah, just looking at the scale is fine, you know, keeping track of their weight. But you see, when you encourage your patient to eat well in order to lose weight, you will not just only talk to them about eating well, you will also encourage them to exercise, and you will encourage them to ask their doctor if it's okay first. And then if they can start exercising, seeing someone who is a professional in like physiotherapy, physical therapy, to have someone put them on an exercise program, we always have to work together. We have to collaborate with those who do physiotherapy, with physical therapy, who do training like that, because we have to work together. And if they can have the appropriate exercises, that would be great, because when they exercise, that increases their metabolism. But the thing is, when you are also building muscle, tell your patient, your client, don't be discouraged, because they'll say, oh my, it looks like I'm gaining weight. The numbers are going up, but my clothes are feeling looser. And tell them that's a better indicator than looking at the scale, because their muscle is probably developing, which is good. And they say that muscle weighs more than fat, as they say. And I like to believe that. And so it's a great thing when you build more muscle, because then that means your metabolism, their metabolism is also increasing as well. And so that helps them too, that they'll be able to eat more. You know, we like to eat, so anything to eat more. So as we're taking these measurements, we have to keep that in mind. If they say, oh, my arm is getting bigger, but that doesn't necessarily mean that they're getting fat. It just means that they're building muscle, and so that's a really good thing. Now, that's where also the BMI, looking at the BMI, might also be not as accurate, because sometimes it may make a patient look like they're overweight. It might be 26 or 27, and that's the overweight range. But if they are a bodybuilder and they do that seriously, their BMI may be in that range, the higher range, but it doesn't mean that they're fat. So there are all these little issues that we have to keep in mind as we are figuring these things out. Again, it's not perfect, but it's a guide for us to use. Okay? All right. So are we still figuring out waist and hip measurement? Very good. Okay, any questions so far about what I've been talking about? No? Okay, so I really want to encourage you to be able to measure skin fold and items like that, because it's a really good assessment as far as where your patient is at according to their fitness too. Okay, let me figure out here what we are doing next. So, Monica, we don't have those handouts here today, do we? The one that I had sent. If not, that's okay. We can always do that some other time. Those handouts? Where's Florina? Oh, you have those. Oh, perfect. Okay. Great. All right, ladies and gentlemen, I see that you have the handout that says Body Composition Lab. We are not actually going to go through every single page here. I just want you to have this as a reference to use. Does everybody have one? Yeah, I mean, but oh, everybody has one? Oh, perfect. Okay, great. Is my water? Okay, so. Okay, we are not going to go through everything in this sheet, but I just want you to have this, because just in case you might work in an outpatient clinic, and then you'll be able to refer to this and actually use this. This shows you how to actually measure the skin folds, and we are going to use a couple of the pages here, but just know that most of this is for your own reference, so that just in case you'll be able to use it later on down the line, then you'll have it. Okay, so has anybody seen this instrument before? Okay, so it's a caliper. Has anyone had the opportunity to use this? Oh, you already have. Oh, fantastic. Everybody else too? No. Okay. Yes, and you have. Okay, great. But then there are a few over here that hasn't. Okay. All right. So we're actually going to do it today. Would you like to come up? Okay, so your name is John, right? Wonderful. Thank you, John, for being my volunteer today. Okay. All right. So we are going to do a very simplified way of figuring out skin fold calculations. For men, we will take it at 3 sections. So he's going to graciously let me pinch him with the caliper. And I am going to take it at 3 places. Your chest. I'm going to take it at his chest right here. So yes, he's going to have to unbear his chest for us. Yes, we'll have to give him a big hand for being brave to come up here and do this. Thank you, John. Appreciate it so much. And then I'm also going to take a measurement from his abdomen and also from his thigh. Okay, so, all right, so I'm going to need someone to help me with the calculations here, okay? So, but just know that for females, it is actually, okay, let me try to get the full screen reading. Oh, I don't like that one. Okay, it's 3 different areas. For females, it's the triceps and the suprailiac right above here and the thigh. Okay, so the thing is, it's not that easy to use this at first. Sometimes it's uncomfortable, and sometimes you feel like, oh man, I don't want to pinch you. I don't want to hurt you. And so just tell them that ahead of time, and then just go for it, okay? Because sometimes you won't be able to get a good reading. And the thing is, it takes time. You have to just keep practicing this. I'm still not as great in it. I'd still like to get better, but we will go ahead and do this. Can you see I'm really nervous about doing this, about pinching? I'm really stalling, am I? Okay, all right. So maybe Maria, you can write down for me the measurements. Okay, so I'm going to try to get 2 readings from each of the 3 sections, because I have to see if I got it right the first time or, you know, I'm way off. So I might have to do it a 3rd time. Okay, so what you'll have to do for, let's go here so I can talk. So for the chest, you have to go in between the shoulder and the nipple. Okay, so right here, I'm gonna pinch you. See, I don't like pinching people. So you have to go, he is so lean that I can't even pinch anything. There's no fat. Okay, so it's gonna hurt. Okay, it might hurt. Does that hurt? No. Okay, so that was a 6 for his chest. Okay, but you have to pinch, and then an inch below is where you take the reading. And it's also a 6 too. Thank you. Okay. Did that hurt? No. Okay. All right. So that's the area where you would take it just right in between the nipple and the shoulder. Okay. And then for the abdomen, he'll have to find his belly button, okay? And then just an inch to the right. Always go on the right side of your patient. Pinch 1 inch, okay? And then take it. Oh, I can't pinch anything here. Oh, this is gonna be hard. Maybe you don't have any fat there. I think I'm gonna go down. Does that hurt? Ah! No. Oh, man. I'm not getting anything. Okay, take a deep breath. Or maybe I need to take a deep breath. Okay. Okay. I don't know why I'm not getting any fat off you. I should be able to. Okay, let's do it that way. I'm going farther away from his abdomen. I'm not getting a reading. Huh. It doesn't, maybe this caliper doesn't like you. Okay. It's not taking it. Okay, let's do 21. 21. I hope I didn't hurt you too much there. Okay. Okay, thank you. Now I'm going to do his thigh, and it's supposed to be in between the knee and the hip. Is that as far as it can go? Okay. Okay, that's perfect. Just right in the middle. Okay, so you need to pinch at the top and then go an inch below. Oh, I can't really. Okay. Thank you. Thank you. All right. Okay. Okay. Thank you so much. I appreciate that. Okay, I'm trying to pinch him and I'm trying to go an inch below, but I'm not getting any fat because he's not very fat. So we're going to try to do it again. Okay, it's 11. 11. Thank you so much for your help. I appreciate it so much. See, it's not that easy to do. So especially if they're very thin. I mean, you're not skinny, but you're just right. You're lean. So thank you so much. I appreciate it. Thank you. Okay, so Maria, can you please total those numbers for me? Thank you for your help, John. I appreciate it. 38. Okay. So if all of you can please take the sheet and go all the way down to, what page is this? Page number 5. You will see a nomogram. That's what it's called. The chart is called a nomogram. 38. Okay. Can I please ask John how old you are? 40? 4 years old? No. No. 40. Okay. So you'll have to take a piece of paper and look at his age here, which is 40. He's male, and actually the total sum that we came up with for his skin folds was 38. So here on the right side, sum of 3 skin fold areas. So look at the age over here, 40, and let's look at 38 right here. 38, 40, 38, 40, okay. 38. Okay. So it's about, I would say 16.8. No, wait. Oh, I'm sorry. I was looking at the female one. 13. Okay, it's 13. Good, good, good. Thank you. I was looking at the wrong side. Okay, so according to the skin fold, according to the nomogram, his percentage of body fat is 13. And then so if we go down to the page number 7, and if we look at male, since he's 13% male, it says where it says healthy 8 to 15%, and he goes right in there. He's 13. So your classification is that you're healthy. Awesome. Yay. Wonderful. That is great. Okay, so when you're assessing your patients, you can actually put that in their records that their body fat is this percentage and their body fat classification is healthy. And I wanted to show you something else here too. Okay, where is that? So according to the American College of Sports Nutrition, you can also go ahead and look at this. Control L. Okay. And this is the fitness category, but I lost it. Oh dear, how do we go back? Okay, so his age for male, he's 40 and 13. Okay, so where it says here 40 and he's in that category, 13, and then if you look at the fitness category, it's well above average. So his fitness level is great. That's one of the aspects to look at. Of course, there are other tests like push-ups, sit-ups, how many you can do that the American College of Sports Nutrition has, but at least with the body fat percentage, it's telling us that he is at a good level. And if you have a client in which their numbers are not as good as John's, then, you know, that might encourage them to, wow, I really got to work at this because I want to get to that category where I am well above average. Okay, so that's one of the things we can do. So I don't see Daniel here. He's not coming. Okay. Because he knows how to use this machine, and I wanted to compare you know, using the skin calipers and this one. So, but he might be coming later, so we could do that later on. Okay, does anyone have any questions about that? No? Okay. All right, so just one more time, I'm putting up here the Hamwi method way of figuring out things. What I want to show you next is how to figure out the adjusted body weight for your patient who is 120% or more of their ideal body weight. If their percent ideal body weight is between 90 to 119, then they're fine, okay? You can use that weight to figure out their calories and protein. But if it's 120% or more, we have to do an adjusted body weight. So let's pretend that we have a gentleman who is 5'10". And he is medium framed, and he happens to be, I am going to say he happens to be 250 pounds. So we will go ahead and convert this. Okay, so I'll need help here. So for someone who is 5'10", that is 60 inches. So if we'll take 60 inches and we want to convert that to centimeters, so what would I multiply by? Does anybody know that factor to convert from inches to centimeters? Actually, 2.54. Yes. So I'll need help, Maria, again. So let's take 60 inches times 2 point, whoa, how did I do that? Okay, times 2.54. This will give us 152.4. Okay, thank you. So that gives us the height of this gentleman, our pretend gentleman that we are talking about here. And we have pretended that he is about 250 pounds. Okay, I am going to convert this to kilograms. So I will divide this by 2.2. Yes, you're absolutely right. Divide it by... Okay, let me just put in the little symbol sign. Thank you. Okay, divided by 2.2, and what's the answer? 113.63. Okay, kilos. Okay, here we go. Okay, so for someone who is 5'10", a male, and he happens to be medium framed, let's figure out his ideal body weight. So this is what we're going to do. The first 5 feet, how many pounds are we going to put down? 106, yes. Great. And then he is 10 inches above 5 feet. So I'm going to take 10 times what number? 10 times 6, because it's 6 pounds per inch above 5 feet. So 10 times 6 is 60, so we will add 60 to the 106, and that gives us 166 pounds. This is the patient's ideal body weight. But we're not done. We have to convert it to kilograms. So let's please take 166 pounds and let's divide it by 2.2. And that will give us what? 75.4. Okay, we'll just say 5. We'll just round it. Okay, so this is our ideal body weight for our gentleman. Now let's take, I hope this will work. I hope I chose the right ones. Okay, so to find out his percent ideal body weight, we have to take his current weight, which is 113.6 kilograms, and then I am going to divide by his ideal body weight. You take his current weight, you divide by the ideal body weight, which is 75.5. And okay, so it's 1.5, and then I'm going to take the 1.5 times 100, and so that gives me 150%. So yes, our person is very, very big here. Greater than 120%. So we don't want to use his current weight to figure out his calories and protein. Otherwise, he will continue to be at that weight, and we don't want him to. So, or he will continue to put on weight also, or maintain that weight. So the type of weight that we want to use for him is an adjusted body weight and to help him lose a few pounds. So what we're going to do is we will take his current weight, which is 113.6, and we will subtract the ideal body weight, which is 75.5. And what is that answer? 113.6, his current weight, divided or subtract his ideal body weight. 38.1. So the difference between the his current weight and his ideal body weight is 38.1. That's the difference. But we only want to take 25% of this 38.1. 38.1 times 0.25 gives us, I'm sorry, 9.52. Okay, 25%. Okay, that difference, 38.1, is the excess amount of weight that he has, but only 25% of the fat is metabolically active. And so that's why we only take 25% of that difference. But now for the adjusted body weight, we will go ahead and take that 9.52 and we will add it. Add it to the ideal body weight, which, what was our ideal body weight? Thank you. 85.02. Okay, 0.0. So this is his adjusted body weight. So this is where we want him, that's what we want to use when we are actually figuring out calories and protein for him. Now for you and for me, just for maintenance, we can actually say that we need about 30 calories per kilogram of body weight. Okay, so if someone happens to be 50 kilograms, then you times it times 30, then their caloric needs for the day is 1,500. That's an easy way. A lot of dietitians use that. But there are all the fancy schmancy ways of figuring out caloric needs, like the Harris Benedict, and all the newer ones that have come out, that you could definitely use. In an intensive care setting in the hospital, you might really want to use that because it takes in other factors like, are they on the ventilator or not? Do they have this or that? Are they male or female? And that's fine. But you know what? Not that we're lazy, but a lot of us do just like the calories per kilogram way of figuring out calories. But depending on who you will be working with, who you will be training with, whichever dietitian, some prefer certain ways than the other. See, the more you practice, and depending on what population you'll be working with, you'll realize that certain ways of figuring out calories will work for this type of population. For a different population, this other way of figuring out calories may be the best way. But this one is like your tried and true way of just at least a good starting point. So for our gentleman, and we want him to lose weight, we're going to encourage him to exercise more, then you can actually go down to 20 to 25 calories per kilogram, especially because he's that much more. And so his needs then would be 30 times 20. Wait. That is just looking. Sometimes you might have to use your clinical judgment and say that's just too low if it's 20, if 20 is too low. For a BMI of 40 and above, I definitely go down to 20, but I haven't figured out his BMI yet. So 25 times 30. Can someone please figure that out for me? If I had a scratch piece of paper, I could do it. I'm sorry? 25 times 30? 750. Oh, okay. You know what? I'm not using. I'm sorry. I'm not using his weight. I'm confusing myself. Use 85, his adjusted body weight, times 25. Sorry, 2,105. Okay. Okay, so this is about the amount of calories he would need per day. You can use 25, you could go 25 to 30, and it would be a good start to figure out how many calories he needs. And if he is someone who's very physically active, who's going to be running 3 or 5 times a week, then you can actually add another 200 calories or use that 30 calories per kilogram. Okay, so for weight loss, at least 25 calories per kilogram would be the way to go. And if the BMI body mass index is just astronomical, it's way up there, then you can go down 20 to 25. Having a range is good. And just know that, because some of our patients and some of the dietetic students that I've worked with, when they're trying to figure out meal plans, they get so stressed that, oh man, I know they need about 2125 or 2100 calories, but I've calculated this meal plan to be 2200 calories. And they stress about that it's not 21. But you know what? 100 calories won't hurt. It's fine. It's okay. Just relax. So we're not about pinning ourselves to exact numbers, but at least we want to get as close as we can. And it's a really good guide to start our patients off with. Okay. I think it's time to go on a break, and we will continue when we get back. If you have any other questions, please let me know. Okay. Thank you for being my assistant.